advanced directives are important for anybody, any age, any stage, even no illness. So I believe advanced directives ought to be something that we should all start promoting with a driver's license. 16-year-olds ought to have an advanced directive. 16-year-olds, by and large, don't need a post program or a post form, which is intended primarily for folks for whom you wouldn't be surprised if they might die in the next year. So most of the population don't need a post form along with their durable power of attorney or their directive to physicians. But certainly many patients who we work with in palliative care do fit into that category. And so having a portable list of physician orders that emergency responders can react to, and that a patient can take with them from one setting of care to another if they go to a hospital or they go to subacute care or residential care in some way or at home. That's the purpose of a post form, is to translate one's advanced directives into active physician orders that can be acted upon in an emergency room or by the paramedics or in the hospital setting. So there's real value in having that. One of our subtitles to the post form is, it's a great form, but it's not about the form. Again, it's about the conversation. It's about reflecting what patients really want, and then having that be able to be followed wherever they go. It is the only physician order that patients co-sign. In almost all states, the post form includes a patient or their surrogate's signature, as well as a physician, nurse practitioner, physician assistant signature too. And throughout all of our healthcare system, nowhere else does a patient countersign their own doctor's order. So it's intended to be very collaborative. It's intended to be part of a meaningful conversation with the patient or their family or both, and a provider. So there's a lot of good things about a post form. And for those for whom it's appropriate, again, folks for whom they're enrolled in hospice or they may have advanced chronic disease, post forms, we know from studies now that they not only help make sure patients avoid the kinds of interventions that they don't want more reliably if they document it on a post form, but it's not just about saying these are things I do not want. It's also about saying what you do want. And we found from a study in Oregon that if you, for example, want full CPR, full care, full ICU care, documenting that on a post form, and there's always spots for that on all the post forms in every state, if you document that and sign that, you're much more likely to get all of that than if you just leave it to default, when in theory the default is we always do everything unless someone says no. But if you actually document that, you're more likely to get that than if you just leave it to chance. So post form is about translating patients' advanced directives into actionable physician orders and having that direct your care. It can be changed at any time if there's a change in situation, but documenting it and getting it a physician's order is an added quality component, if you will, to make sure that patients' own wishes are actually followed.